Scott, what I'd like to do now is kind of go over, the mini CEX and provide you with some feedback about, how that counseling session just went with Mrs. Sweet. I'd like to ask you first, so how do you think it went?
Well, I think it went pretty well. She and I have a really good rapport. I've seen her a few times, and she's one of my favorite patients.
Well, I thought, from kind of the strengths of that particular counseling session, I thought you were very humanistic. I really enjoyed and appreciated your empathetic tone. You do really seem to care about Mrs. Sweet, and I think that's very important. I think that came across today. I have some concerns, though, about how you described her, diabetic therapy. In particular, although you mentioned you'll be starting a medication for her diabetes, you never told her what the name of it was. You also didn't tell her how it worked. More importantly, you didn't tell her what the side effects might be. So what are some of the side effects of glyburide?
Well, the big one I'd be worried about with her is hypoglycemia.
Right, exactly, particularly since you're starting it for the first time. What dose did you start her on?
Well, I went ahead and started her at 5, but, that might be a little bit high.
Yeah, no, I think that's good insight on your part. I mean, we might want to call her back, actually, just because, again, her fasting sugar was only 182. Although high, 5 may just be too much for her. And, again, you can titrate that up as necessary. So I agree with you. So it's very important to let the patient know what it is they're taking, the name of the drug, mechanism of actions, and potential side effects, particularly if the side effects can carry harm. And as you know, hypoglycemia can potentially do that. So that's very important. In addition, you also need to check in with the patient and make sure that she understands exactly what's happening to her. Okay? Why do you think that might be particularly important for Mrs. Sweet?
Just to make sure that she really gets what I'm saying. I mean, it all makes sense to me, but maybe not so much to her.
Exactly, and she's just received a new diagnosis of diabetes, and you got that kind of concern from her at the end, didn't you? Like, golly, is this something really serious? Because there's a lot of stuff that goes with diabetes.
Yeah, I did. It's really hard when you get behind.
Yes, and I think it's important, though, that if you don't take the time to do this now, it may cost you time later. All right, so that's important. So checking with the patient understanding is very important. Telling them, what the mechanism of the action of the drug is, etc., is all very important. What you did do is you did tell her how her diabetes relates to her symptoms and why you're starting the medication. That's good. That's important. You need to explain, what's the relationship between her disease and the treatment. You also need to check on her preference. You need to find out, does she have a preference? What are the other options for therapy for diabetes in this case? What do you think?
Yeah. Well, I could go ahead and start, something like metformin.
Okay.
She's pretty thin, so I think maybe the glyburide was a better choice.
Good. So I agree with you. So you, I think, are thinking, mechanistically very well that maybe it's a better drug. Metformin might be more effective in obese patients. That sounds very reasonable. Diet might be something that she may really want to try. Yeah. Although, as you point out, given her size, that may not work for her.
Right.
Okay? So, when we do the mini CX, we rate this on kind of a 9-point scale. And when it comes to informed decision-making, some of those elements are really critical that we just went through. So to be honest with you, I'd probably call the counseling part with regard to medication unsatisfactory. I'd give you a score of 4 out of 9. How do you feel about that?
Okay. Well, I felt pretty good about it, but given what we've talked about, I really think that's pretty fair. I think you've given me some good things to work on and get better.
So I think those are things to think about next time you're starting a new medication or explaining something to a patient. But I do want to emphasize, I thought, again, your approach with regard to humanism is very good. So that's also a strength that, I want to also make sure that you recognize you're doing, I thought, particularly well.
Good.
Okay?
Good. Okay.
So where do we go from here? What do we do?
On to the next patient. I think I go over in my head how to do this a little better and a little differently.
Good. Okay.
And I work on it with every patient.
Great. And I'll probably come back in and watch a few more counseling sessions to make sure you're comfortable doing that.
Good. I really appreciate it.
Okay, great.
Thank you.
All right.
Good.